Dear students, we'll discuss a post-operative photo of a patient. Just see how exactly it looks like. Look at that. This is the urethra, which is created new in the bulbar urethra. Actually, it's a bulbar urethra. We made a stator there, identified it, and sutured it as a catheter. We used a 30 vehicle for that. And this is called perineal urethrostomy, usually done after a total amputation of the penis for carcinoma penis. So carcinoma penis usually squamous cell carcinoma, can be rarely adenocarcinoma, melanoma, soft tissue tumors can occur commonly. If it is within the glands or prepuce, then you can save the part of the penis. Partial amputation can be done. Of course, along with that, if lymph nodes are involved, then you have to do one side or other side ileoinguinal block dissection, the same sitting or after 3 weeks, depending on the situation and individual surgeon's choice. But once carcinoma extends proximally to the body of the penis, then no way we can save the part of the penis, and partial amputation is not possible. That is called Young's operation, and then you have to do the total amputation of the penis. So entire penis has to be removed with the tumor. Then for pass urine, you have to do a perineal urethrostomy. You have to lift the scrotum and make an incision in the lithotomy position, identify the urethra, open the urethra. Distal urethra is removed, of course, along with the amputation of penis. Then suture it, split it vertically like a fish mouth. Then suture it to the 30 vehicle to the skin, and pass a catheter, keep it for 3 to 6 weeks until this urethra suturing heals well and matures well. Matures well. That's the word we use clinically and technically we use. And this is what exactly we have done. So keep catheter for 6 weeks until this urethra matures well and takes up into the skin. And patient has to pass permanently. Catheter is not kept permanent. The catheter is removed later. Patient has to pass urine through this perineal urethrostomy. So male patient, being a male patient, patient has to sit and pass urinate in these patients, because standing is difficult to urinate in such patient. So it's a diversion procedure also many times as a temporary one, especially if there is a urethral injury, urethral injury, distal urethral injury. So PC also done, but sometimes the diversion also done, but eventually it may be closed. So there are different indications. So problems are the ammunical dermatitis of the scrotum and urethra, and infection. Urethritis, stricture is very common. It got during healing process, it goes fibrosis and stricture occurs. So you need to have a regular dilatation in such a patient. Sometimes they need a reconstruction of the again stricturoplasty you have to do with the help of the urologist or plastic surgeon. So you can always go through my SRB's manual of surgery about in detail about the carcinoma penis, ileoinguinal block, destructs quadrangle, and cabana lymph node, then other things also, then ileoinguinal dissection, total amputation of penis, partial amputation of penis. Carcinoma penis is kept as a short case also. Theory also they will ask, short note also they will ask, and perineal urethrostomy is a spotter sometimes, and neet exam, MCQs also they will ask. Very common, very important entity which you have to know. So these are the things you have to remember. Jackson and DNM staging of the carcinoma penis, ileoinguinal block dissection, biological behavior also, both side inguinal lymph nodes, horizontal group, then external lymph nodes. It's usually local regional disease. Lymphatic drainage penis you have to know. Strategies for the management I already discussed briefly. Radiotherapy is very useful, remember. Adjuvant chemotherapy you have to give in afterwards. Sometimes if it is say 3 disease, T3 or extended proximally, very proximal part of the penis, then you may have to give chemoradiotherapy first as a new adjuvant, then go for total amputation and ileoinguinal block dissection both sides, then continue the chemotherapy later period. Role of radiotherapy, restless quad, all those things you have to go through, you have to understand as far as carcinoma penis is concerned. So please go through my manual of surgery and physical methods in surgery for the better understanding of this. So student, please subscribe my YouTube channel. Daily brief lectures are there. It is very useful. It is free. It will upgrade your surgical knowledge as a daily, day-to-day basis to case scenarios, images, instruments, and brief operative procedures will be there. So MCQ, answer it. I will acknowledge your answer. Sentinel lymph node in carcinoma penis is A, B, C, D. Right, put the right answer. Answer the MCQ. Restless quadrangle is, check the boundary. Go through this and put the right answer A, B, C, D. And I'll get back to you. I'll acknowledge your answer. And quotation of the day is, when you get tired, learn to rest but not to quit. It is not you should quit and come out. Have a rest and plan it again. Go ahead with the difficult. Once you reach the goal, you'll be happy that you have passed through that, you had idea, you have learned so many things. So you can rest but don't quit. That's the exact meaning of this quotation. Students, again, I'm requesting to have SRB's manual of surgery and SRB clinical methods in surgery, to have entire subject knowledge for your exam, for neet, academic, everything. And also, please subscribe my YouTube channel for daily upgrading your knowledge, and also live sessions once in regular intervals, so long with different faculties, senior faculties, really long case discussions, it's management policies, everything very, very useful for you all. Clear the exam and understand the surgery. So students, please go through my SRB's manual of surgery. It gives a detail about all CBME syllabus and covers both for MBBS and postgraduate also. You got MCQ for each topic wise. General surgery, gastroenterology surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic, all those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also, everything covered with the quotations, with the illustrations, with the photos, everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery and face exam, place MCQs, everything for both UGs and postgraduate. Also go through my clinical methods in surgery with the video of how to examine in each topic. It gives a detailed examination method, but of course there is no management in this. It is a clinical book, and briefly in a tabular form, differential diagnosis, and good photos, and exactly how to examine and how to write case sheet of each different topics, ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and Oxy and practical exam. So very, very useful, because we have all videos of how to examine a patient. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different operations, major to minor, everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and you can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year, so that you will have the clear idea. You can face the exam, have the clear idea, economic part, everything. You will have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and face the in a better way. So students, I hope you understood this lecture very well. Thank you so much.